You are about to review the messaging portion within the Myway application. Within the Myway application, we actually have an internal messaging system or an internal communication. What I mean by that is you don't actually have to utilize Microsoft Outlook. You don't have to purchase the hardware and the software licenses. All this comes built in within the system. From your desktop, there's a couple different ways that you can actually access your messaging. The way that I have my desktop set up, you're going to see that I have a message center. And what this truly is, if you guys are familiar with Outlook, it gives you the ability where you can set up folders to see, here's everywhere that I might have my RX refills. And we can customize these columns, but I have it set up to say, here's my urgent emails, my maybe abnormal labs, my routines, and then my low priorities. So just at a quick glance, I can see I actually have 19 total messages, and then here's some of my messages being broke down by my category. The other way I can have it set up is I'm going to choose my secondary tab. I can just have a regular inbox. So here's where you're seeing all 19 of my messages. Each of those messages actually have a hyperlink to open up the message, or I can go into the patient's demographics right from there. So there's a couple different ways. It's just truly the best way that your practices medicine and goes through their workflow. If I want to add a new message, or I want to send a message to someone else, or maybe even create a task, I can come up here to new message. Whenever I come up to new message, you'll see here's some of the different types of messages that you can create. If I want to come in here and I want to create a new call, you'll see that this is another place where you can set your mandatory fields just by seeing the yellow color. Here's where we have the ability where we can come up and pull up a patient. So we're going to say, who is this message about? We're going to choose John Barry. So we can set our urgency, any type of subtype, which just would be like a category, or a due date. So if you want something to see, maybe this is due next Friday, this can be a very important field to help your practice track what needs to be done. It's almost what a to-do list. This will also, when it goes overdue, it will pop up in bold letters and say overdue. You can assign this to an individual person in the practice, or you even have the ability where you can set up groups of users set it up. This can be great if you maybe have a couple nurses that all share and do rounds with the doctors. You can just send one message to all the nurses. Benefit is once one person actually signs off on that message, it will remove it off everyone's list. So we're going to send it maybe to the administrator and maybe to the billers. I'm sorry, we'll actually send it to the clinical administrators. Get rid of billers. Once we end up going there and we select that, now here's where we have the ability to type in our reason. So maybe John needs to be called based on some of his abnormal lab results. We can come in here and we can type anything that we need to. So it's very easy just to come in here and type. Now, a lot of the times, messages are going to be very common. So they're going to have particular ones that they're sending over and over again. The other benefit is where you see this little blue hyperlink that says reason. Here's where we can actually come in and we can build macros or build some of our favorite ones. And you can see just a list of our most frequently used on the left-hand side. So it's a great way to save that typing because we know that most doctors and nurses aren't gonna be, first of all, be very efficient or proficient typing their information. Once I'm ready to send that message in the lower right, I can choose my OK button. And now I've actually sent that task on to whoever I need to. If I want to open up a task and actually review a task or review a message, I can come in here and I can choose my date and time. You can see that these were overdue, so these actually did have a due date that was set. So I can open up one of these messages. Whenever I open up this message, here's where I have the ability to add a note. Maybe I even called the patient and I took care of anything that I need to. If I want to remove this from my list, I do have the ability where I can forward it to or assign it to another user. Or in the lower left, I could truly just come in and I can complete that note. And what that's going to do is that's actually going to remove that message from my screen. Some other different types of messages that we have that are important. Okay, we have tasks, but probably one of the most important ones that you're going to be dealing with on a regular basis is prescription refills. Within prescription refills, you can actually come in here and you'll see a couple different fields. Of course, you're going to have a patient that you're going to attach that RX refill. So we'll select a patient in here. We can assign those to multiple users or just one user at a time. I'm going to send it to our clinical administrators again. Now here's where you actually have to say who is the provider that should be refilling this medication. So I can come in here and I can select Dr. Blogs, and then what is the medication that they're actually searching for. So I can come in here and maybe I can just type in a medication. I have the ability to add in different comments, and I can even refill or add multiple medications right from here. Remember that this is truly just a phone call, so most of the time you're actually going to have a front desk person or a triage person taking these phone calls and then passing it on to the appropriate people. You also have the ability here in the lower left where if there's a pharmacy that they want to either e-prescribe or fax it to, we can enter in that information. I'm going to choose my OK button, and now that message is sent. If I do receive a refill request, if I want to actually action that off and prescribe a new medication or find one from the history, I can open up that message. Whenever I open up that message, the reason that it's going to be a little bit different is here's where I can actually come in and select a drug from our dictionary that we have. I'm going to come in here and we'll say that the patient wanted to be seen on Xanax. I can type in the first couple letters. What that's going to do is that's going to look through my whole database, and I have the ability to select a strength. I can choose the strength, and then what's going to happen is a SIG writer is going to pop up. So here's where I can fill in some of that information about how often should they be taking it. I'm going to say it's as needed. We're going to say no refills. We gave them 14 of them. Choose my OK button. And now that medication's actually been prescribed. Once I'm done, I can complete this note or this message, and I can go right from there. That's going to cover and entail our whole messaging piece. The importance of messaging, just to recap, is to make sure that we streamline communications. We definitely want to improve the quality of care with patients, and then we want to overall make sure that doctors aren't losing those little sticky notes or little pieces of paper that they're typically attaching to the chart.